According to the Center for Disease Control and Prevention, CDC, depression in the United States is the primary reason why an adult dies because of the suicide every 12 minutes. It's over more than 41,000 people a year. I decided to inform you about the depression in the college students because that's a serious issue. Studies show that the college students who have depression, they are more likely to smoke, drinking alcohol, or even suicide. Depression is the most common mental health disorder that in different cases have different symptoms. If we know the cause of the depression, that might be easier to find out the most effective treatment for that. Today, I will talk about the sign and the symptoms of the depression first, and next I will talk about what cause of the depression, and then I will present you the most common types of treatment for depression and how college students can get help from their college that they're attending to. So first, let's start with the sign and the symptoms of the depression. It's based on online research. People who are suffering from depression might experience the loss of interest in activities that they used to enjoy, problem in concentrating, memorizing the information, and even making the decision, loss of appetite or overeating, problem in falling asleep, staying asleep, or even sleeping too much, pain, headache, cramp, and digestive problems that do not go away for a long time. These symptoms should be last at least 2 weeks to be considered as a depression symptoms. According to the Journal of American College Health, female showing higher depression and anxiety symptoms than male. So now I'm going to move on to what causes the depression. There are two most common factors that increases the risk of depression. Which one? The first one is genetics and the environment. However, not all the people who are carrying these genes are depressed, so the environment is most important. Some of the important factors that increases the risk of depression in college students are living away from their family for the first time, experiencing a conflict in relationship, feeling lonely and isolated, and facing the new and difficult schoolwork, and worrying about the their finances. And finally, I would represent you the two most common treatment for the depression, which are antidepressant and psychotherapy. Psychotherapy is basically talking with a mental health care professional, and antidepressants, they work on brain chemicals, are called neurotransmitters, especially norepinephrine and serotonin. Some of the antidepressants are work on neurotransmitters, dopamine. Scientists believe that these particular chemicals are involved regulating mood, but they don't know exactly how they work. College also provides some mental health service for their students through counseling center and a student health center. Counseling center basically provide the service for the student for free or a very low cost amount of money, which including the short-term or long-term counseling or psychotherapy. Student healthcare service is also free or very low cost for the student, and either the doctor or the healthcare professional can diagnose and treat the depression, or maybe they can refer the student to the other mental health care services. Scientists show that more students are seeking mental health service on campus than before. Cornell Health Counseling and Psychological Service, for example, served 21% of the Cornell University students in 2016-17 academic year, compared to only 13% in 2005 to 2006 academic year. In conclusion, depression is the most common mental health disorder that in some cases can be very serious, like a suicide. Today, I talked about the symptoms and the sign of the depression, what causes the depression, and how can people get treated, and how the colleges provide the services for treating their students. Now you, as a college student, if you're suffering from depression, do you still think that you can seek help?